Good morning, Deborah.
Good morning.
Here is your patient scenario.
Okay.
Thank you for your checklist.
Okay, what time is it?
It is now 2100.
Okay. So I have a patient. His name's Tim Boland, date of birth 6/5/1943. I'm working in the ER at Weatherford College Sim Hospital, where I'm providing care for a patient who is admitted with complaints of left side weakness, facial drooping. Symptoms began 2 hours prior to arrival and has increased in severity. CT scan of head has been performed, no intracranial hemorrhage noted. The physician has ordered stat orders. The patient has a history of hypertension and high cholesterol. So, physician orders acute ischemic CVA and hypertension as the diagnosis, labs PTT and a PT-INR, heparin 1,000 units sub-Q Q12, warfarin 5 milligrams PO Q day, lisinopril 20 milligrams PO Q day, Lipitor 80 milligrams PO Q day, and Fluzone 0.5 mLs IM times 1 prior to discharge. Gonna verify that against my physician orders.
Okay.
So I have labs PTT PT-INR, heparin 1,000 units sub-Q Q12, heparin 1,000 units sub-Q Q12, warfarin 5 milligrams PO Q day, warfarin 5 milligrams PO Q day. I have lisinopril 20 milligrams PO Q day, lisinopril 20 milligrams PO Q day, Lipitor 80 milligrams PO Q day, Lipitor 80 milligrams PO Q day, Fluzone 0.5 ml IM times 1 prior to discharge. Fluzone 0.5 ml IM times 1. Okay, now I'm going to compare my physician orders with my MAR to ensure accuracy. So I had heparin 1,000 units sub-Q Q12, heparin 1,000 units sub-Q Q12. It's due at 9. It's 9 now. It's safe to give. Warfarin 5 milligrams PO Q day. Warfarin 5 milligrams PO Q day. It's due at 9. It's 9 o'clock at night. It's good to give. Lisinopril 20 milligrams PO Q day. Lisinopril 20 milligrams PO Q day, due at 9 a.m., so I would not be giving that. Lipitor 80 milligrams PO Q day. Lipitor 80 milligrams PO Q day. That's due at 9 p.m. It's 9 now. Safe to give. Fluzone 0.5 mLs IM times 1 prior to discharge. Fluzone 0.5 mLs IM times 1 prior to discharge. Patient is not discharging at this time. Does not need to be given. This is for Tim Boland by Dr. Gray. Date of birth is 6/5/1943. MRN 22345, 22345. They match, okay? All right, I'm ready to pull my meds.
Okay.
Okay. I'm gonna go. So I know I need heparin 1,000 units sub-Q Q12. Here I have heparin 1,000 units per mil. Warfarin 5 milligrams PO Q day. I have warfarin 2.5 milligrams PO Q day. I will not need my lisinopril because it's due at 9 a.m. But I will need Lipitor 80 milligrams PO Q day, Lipitor 80 milligrams PO Q day, and I do not need the Fluzone because it is not prior to discharge. So I have my correct medication based on my MAR, so I'm going to come sit down. And this is the time I would have my drug book, be able to look at my drugs and do any dosage calc that I have. So I want to go and do another verification check as I'm doing that. So heparin 1,000 units sub-Q Q12, due at 9. This is heparin 1,000 units per mil. So for that, I would do 1,000 over 1,000 times 1. I know I need 1 mil. If I look it up, I know heparin is a blood thinner. It's sub-Q. I know that there was a PT-INR ordered, so I want to make sure I look at that lab. warfarin 5 milligrams POQ day, warfarin 2.5 milligrams. It's not expired. So what else I need to do is I know I need to do some dosage calc. 2.5 or 5 divided by 2.5 times 1 is 2. I will need to give 2 of those. I do not need my lisinopril, but I do need Lipitor 80 milligrams POQ day. I have Lipitor 80 milligrams POQ day due at 9. It is not expired, safe to give. I'll take the rest of my time looking at my medications. Then I'm ready to go get all the supplies I will need. I'm going to take out any medication that was in here that I do not need. That way I can safely use my box. I know I will need a medicine cup. I know I will need some alcohol wipes. I know I'll need a glass to give my patient water. And then I'm giving a sub-Q injection. I'm going to give 1 ml. So I need a 3 ml syringe. I need a blunt tip needle to draw it up. And I need a 25 3/8 or 5/8. Okay. All right. Here's another time I can do an additional med check if I want to make sure I have everything ready, but I do not want to open my meds until I talk to my patient. I do want to look up one time to make sure my patient's labs were drawn. Were they?
Yes, ma'am.
Okay. And what was the PTT, PTI? Was it in safe range?
Yes, ma'am.
Okay.
It's 12 and 1.9.
Great. Okay, so I know it's safe to give both blood thinners, so I'm going to go ahead and go into my patient's room. I'm going to knock, close the door for privacy. Good morning. My name is Deborah. I'm going to be your nurse today. How are we feeling? Great. I'm glad to hear you're feeling a little better. Before we get started, can you just give me your name and your date of birth? Okay. Tim Bolin, 6/5/1943, 6/5/1943. Perfect. All right, Mr. Bolin. Well, the physician has ordered some medications for you this morning, okay? We have 2 tablets that I'm going to be giving you. One is warfarin, that's your blood thinner, and your Lipitor, that's your cholesterol medicine. Are you familiar with those? Yes? Okay. The last one we're going to give you is a shot in your belly. It's very small. It's heparin. It's also another blood thinner, okay? It's going to help loosen up your blood a little bit so you're not having as bad as the stroke symptoms. Okay. Would you like to take your oral medication or your injection first? Oral meds? Great. Okay. Let's go ahead and sit you up. Get you nice and tall here. Do you ever have any trouble taking meds? No? Okay. When you normally take your meds, do you take them one at a time or do you take them all at the same time? Generally, if it's only a couple all at the same time? Okay. Well, I'm going to get your tablets ready here, okay? Give me just 1 second. All right. Need my water, my medicine cup. I'm going to start with the oral tablets. So I need warfarin. I have warfarin. So warfarin, 5 milligrams POQ day, due at 9. I have warfarin, 2.5 milligrams. So I will need 2, due right now. It is not expired. I'm gonna open it without touching the cap. There's 2 tablets. I'm gonna put them in my medicine cup. I also do not need my lisinopril, but it is time for Lipitor. Lipitor is 80 milligrams POQ day. I have Lipitor 80 milligrams. It's due at 9. It is 9 now, so it is safe to give. It is not expired. If your meds are in a pack that's already sealed and not one that can be opened, you do not need to worry about taking your meds out. You will just put your blister pack in there. All right. So I have my medications. All right, Mr. Bolin, let's go ahead and take a sip of water for me. Good, that's gonna help the meds not to stick, okay? All right, are you ready? I have 3 tablets here. You think you can take those? Yes, wonderful, okay? I'm gonna give you your meds and some water. Okay, so now we're gonna get ready for your injection, okay? Okay. So I know my injection is heparin. I need to find my heparin. So heparin 1,000 units sub-Q, Q12, due at 9. I have heparin 1,000 units per ml. It is not expired. I know I will need to drop 1 ml. I will need my syringe. I will need a blunt tip needle. I will need a needle for injection, and I need 2 alcohol pads. I have a Band-Aid in case he's bleeding because it's a blood thinner, but I do not necessarily need one for a sub-Q injection, just an intramuscular. So I'm gonna open my tablet. I would take the lid off of this if it was new. It's a multi-dose vial, so I'm just gonna clean, starting from the inside out for 15 seconds. And I'm gonna allow that to dry while I get everything else ready. I'm going to open my syringe and hold it only from the outside of the barrel. I'm going to open my blunt tip needle, and I'm gonna connect them without putting it down or touching anything. I know I need 1 ml. I'm going to pull it just from the base of this plunger to line it up. So my plunger is facing the 1 ml. My container is now dry, so I'm going to inject into it, put it up, make sure my needle is up underneath the surface, and again, without touching, I'm going to pull back for my 1 ml. Okay. Gonna release. I'm going to scoop in my needle. I'm going to open my next. I'm trying to keep everything as clean and closed as possible. I will unscrew and screw this in. Okay, now I have my needle all in place. Going to put this in my sharps box. Now I'm going to prepare my patient. All right, Mr. Bolin, I'm going to lean you back. Expose your abdomen for just a second. Now here with my sub-Q shot, I know I need to stay at least 2 inches away from the belly button as the skin is thick. So I'm actually gonna give my sub-Q shot here. I'm gonna take my alcohol wipe. I'm gonna go ahead and pinch up the skin as it's a sub-Q injection. And I'm gonna start in the middle and clean in a circle towards the outer edges. I'm gonna allow that to dry while I get my needle. I'm going to take the cap off, and because my patient is skinnier, I'm gonna enter in at a 45-degree angle. I'm going to stabilize, and I'm going to inject fully. I'm gonna wait 5 seconds, stabilize, I'm gonna release, and I'm gonna close my safety device on a table. I'm gonna inspect the area. I'm gonna let my patient know. Please don't rub it. It is a blood thinner, so you'll have a mighty nasty bruise if you do, okay? With this, since we've given you 2 into my shark box, medications that thin your blood, I want to make sure you know you look for any major new bruising, any blood in your stool, or if you're coughing up, if you notice any blood whatsoever, I want you to let me know, okay? All right. Are you feeling comfortable? Yes? Okay, great. Let me give you the call light. I'm going to make sure my rails are up, my bed is locked, and my bed is in the lowest position. Now, Mr. Boland, I'm going to go back and check on your order. Someone will probably be back in a little bit to draw your labs again, so don't be surprised. And then I'll be back in 30 minutes just to check and see how you're feeling. If you need anything, please let me know, okay? Thank you.